Jimmy Dura, host of All Things Veterinary, a podcast that connects and unites the animal health community with ideas and innovation, topics to inspire you and energize your day. Hello and welcome to another episode of the All Things Veterinary Podcast. And today we will be joined by our special guests, Darlene Geekie and Dr. Doug McInnis from Western Vet Partners to discuss the very important topic of dental health. Just to give you guys a quick background on our guest today, Darlene is an RVT and has worked in veterinary medicine since 1996 with special interests in the fields of dentistry, ultrasound, anesthesia, and exotic care, which inspired her to teach others in the veterinary community. In 2005, Darlene became co-owner and practice manager of a veterinary clinic, which exposed her to all aspects of practice management. She has also lectured for companies and organizations such as Webster, PDX Biotech, Midmart, IM3, the Arizona VMA, AHA, and the Southern California VMA, and also works with various rescue organizations and is on the board of directors at the Monterey Zoo in Salinas, California. Darlene joined Western Vet Partners in October of 2021 and was appointed to the WVP Medical Advisory Board in January of 2022, becoming the first technician advisor to work alongside DVM advisors and add that technician perspective to elevate the quality of patient care. As leader of technician training and development, Darlene focuses on the growth and retention of veterinary technicians and support of her team members. Dr. McInnis earned his Doctor of Veterinary Medicine degree from Oregon and Washington State Universities and first started his career in a mixed animal practice, transitioning later on to small animal. He was a practice owner of 2 veterinary hospitals when he partnered with Western Vet Partners in 2020. Currently, Dr. McInnis serves as the Oregon delegate to the American Veterinary Medical Association House of Delegates and is a member of the House Advisory Committee. He is also a board member of the Street Dog Coalition that serves many communities across the U.S., providing free veterinary care to those that are homeless or at risk of homelessness. He has also served the Klamath Humane Society with various positions and continues to support by donating many services and providing assistance to the shelter and its animals. He received the Diamond Collar Award in 2018 for his efforts in animal welfare. Guys, thank you so much for joining us. It's great to have you on.
Yes, good to be here.
Excellent. Your biographies speak for themselves. It's obvious you guys have a love and passion for our industry, and it's really neat to have you on and to read that, and just see all the effort and the love you've put in. It's really neat. So it's fun to have you guys on today. And today's topic will be improving dental compliance in your vet practice. And I know both you guys are super passionate about this topic. It's always fun to have these discussions with folks like y'all that are just so into it. So I'm excited to get rolling today. And I thought if you guys are okay with it, we'd just start off by first kind of describing, giving your opinion on the current state of veterinary medicine as you guys see it today. What would you guys say?
Well, I'll start. And since we're on the topic of dentistry, I just thought I'd throw out a little bit of some facts here and maybe how it's changed through the years. And as you noticed in my bio, I didn't give you the year I graduated on purpose. So I'll just say it's been a few. And basically, how did we get to like dental month? I mean, February is called dental month, but especially like at Western Veterinary Partners, we look at dental month is every day and every week and all the time, not just one month. But kind of looking back in time, it kind of started as an initiative with a partnership that the AVMA had with others. And it started back in 1995. So we're about 30 years in now. And the campaign was Pets Need Dental Care Too. That's kind of how it started. And today we hear a lot about One Health initiatives. And I think dentistry is really no different. So that's kind of how it started. And so that passion has really been there for a while. And then also these pets have become more of our family and they're right in our face. And so what's right in our face but their mouth? And so let's take care of that.
Yeah, I'd have to agree with Doug. I just want to piggyback on that. A lot has progressed. We've come from a place where even 20 years ago, where dentistry was very archaic, and it really started to grow into this is a necessary medical need for patients. And as we kind of grew over the next 20 years, we really started to do a lot of preventative dental care, and then COVID hit. And when COVID hit, that really changed dentistry. We started doing a lot more because of inflation and all of that stuff. We started doing a lot more wild by fire, right? It's like all the extractions and just treating what we saw, because there's this constraint in our industry right now where a belief of not enough doctors, being too busy. There's a shift, right? And, I think that we're on this like paradigm right now, and we're trying to get back to wellness care for dentistry and preventative care. And we're trying to find our way back through to that.
You're right. I think we are. There's a shift happening, and
Yeah.
there's so many factors that are competing with each other, internal in the industry,
Mhm.
external, and they can be on completely different wavelengths compared to the topic for today, which is dentistry and how that, where we are today and what's the current state. That's a great point.
Yeah, yeah. I mean, we're all compartmentalizing a lot more, and we're seeing a lot more boarded dentists being used, and technicians being utilized, and different facets. So I think it's going to be interesting over the next 10 years as to where dentistry shifts to.
I think we also have to remember that there's a lot we can do in our general practices and work in
Mhm.
conjunction with our specialists. We get so used to maybe like, oh, I don't know about this, but education and
Yeah.
getting those tools within your practice to help out your clients and patients. I think that's very important.
I love that. And I think it feels like we're still in an industry of there are enough fish in the sea for all of us, and we can cross over into each other's lane from
Yep.
GP to specialist, but specialists a lot of times want to help, whether it's CE or just a consult call. Like there's plenty of overlap, there's plenty of opportunity, and the need is there, thankfully, to pet owner demand that it's driving all of these things, and including this topic. I love, Dr. McInnis, your the kind of the recap of the history, and just to kind of step back and think about that. We've come a long way.
Mhm.
And I think you guys probably agree. We'll maybe hit more. We've got a long way to go, but we've
Yeah.
come a really long way. But to your point, the pet owner and the human animal bond keeps driving it. I think this topic never before. Like the dogs in my dog, is an English Cocker Spaniel. He's a cuddler. He's a clinger. I think he wishes he were a parrot on my shoulder. And so his face up against mine, like I'm in tune with his oral care, very in tune on a daily basis. Darlene, just hitting back, it's funny you say that about preventative care, and we'll get off, kind of the state of the union of dentistry, if you will, in just a sec. But I think it is worth pointing out, wellness did hit kind of a brick wall somehow, some way, and I think it was the chaos and we were thrown to the wolves all of a sudden, late 2020, and the preventative and the wellness, it fell by the wayside, it seems.
Mhm.
I think we have to remember too, wellness takes a lot of education and a lot of discussion and learning. And that was taken away in COVID because they were outside and you didn't have those really authentic conversations with your clients.
I would add to that too that most of our practices are set up by times. We only have X amount of time with our clients. And if we're dealing with situations like we dealt with COVID, it's not the right forum
Right.
to discuss wellness and preventive care. And it's also, we don't have enough time. We were hit with all of these things. So now that we're kind of in that post COVID era, it's time to kind of step back, get re-energized with some of these things that our clients are wanting and kind of demanding. And so I think it is time to focus back on dentistry.
That's a great point. And Darlene alluded to this earlier with costs rising on every front in every industry and facet of our lives. Care for your four-legged family member is one of the pieces to a big puzzle. But now that we're in a different spot, preventative care, I think that inflation or costs and just the state of our economy or whatever you want to call it, I think that paves a good discussion for preventative care. The cost today, maybe your cost as a pet owner today and how to prevent and care for a long time can
Mhm.
be more cost effective and just less impact on your wallet as you're standing in front of our reception desk or exam room today. Here's a good way to, prevent something in the future. Maybe we can
Yeah.
hit on that. But while we're on that kind of vein, are there any other obstacles that you guys see to dentistry being a focus or something to emphasize in the general practice?
I guess I would start at, we've already mentioned kind of the time constraints that both clients have, as well as our veterinarians and our team members, with only so much time to deal with things during the day. So definitely the time constraint. Darlene touched on, kind of the economics and the concerns that are there. But really, I think chiming into that one, where it's an obstacle, it's also an opportunity. Because if we can start earlier on and get back kind of like where we were at almost pre-COVID, it felt like we were advancing dental care to finally we got to the point where we're talking about prevention and doing our dental prophies at an early age, and we kind of lost that. So I think resetting, recapturing that, and then discussing that and educating our clients that, hey, this is an investment for the life of your pet that will actually save you money and make for a healthier pet and better outcomes.
And I'll piggyback on that too. I think that, look, we made it through the '09 bubble, right? So we had a big financial, situation there. We all made it. And I think the people that made it thought outside the box. And we're really figuring out different ways to show value and to practice medicine and be able to survive that. And I think we're in the same situation, only we're in a shift of technology and we're in a shift of a lot of things. So we have to remember to utilize things to show value. I mean, we have technology at our fingertips right now to be able to educate our clients and get back some of our time. There's wonderful text message videos and videos within your practice. Get back some of your time. It doesn't have to just be all on you. And I think that that's what we need to kind of think outside of the box as to how do we tell our clients that this is an important value? How do we share to them that they can reduce cost by being preventative? If we're doing preventative dentistry and we're doing home care programs and we're really spending time on educating that, then we're going to reduce costs to the client and it's not going to be so expensive. So I think it's really just getting out of the little box of dentistry and thinking outside of it and creating something new and amazing.
Can you guys kind of describe the things that you recommend, to promote within the practice to your clients on the preventative line, if you will?
First and foremost, it's early detection of disease. So, utilizing modalities for that. There are diagnostic strips, there are flipping the lip, learning about your periodontal levels. Anytime there's halitosis, I tell everybody, your patient's walking through the door. Every single patient that walks through the door is in need of some sort of dental conversation, whether that be a puppy, and that's early periodontal discussion, right? So teaching them how to brush, teaching them about different modalities of home care, good to chew, better to rinse, best to brush, those types of things. And then also to our older kiddos, where it's getting them on a regimen, not just looking when they're there once a year. Maybe 2 or 3 times a year, they get a tech check or they get a doctor revisit on dentistry, and just taking a look and making sure that it's part of every exam. And I think if we can catch things early, we're going to be better off. So that's the first part of preventative, and then home care and the follow-up. We can't just clean their mouths and send them home and never see them again. I think it's really imperative that we follow up and we have a regimen for them and we have a home care program for them. And maybe that follow-up is, how is it doing? How are you doing with brushing? Are you compliant? Because we know not everybody's going to be compliant. There's only those unique individuals that will brush every single day their pets' mouths, right? So coming outside of that box again and developing regimens that fit busy people in their lives.
Yeah.
So that's where I start.
Yeah, and I also think on the preventive care piece, kind of looking at it as a bigger picture here, we do all these things for our pets, parasite prevention, vaccines, and everything else. And it's really to keep them healthy. However, the number one thing that is up there, the highest, is dental disease, periodontal disease. 80% of dogs, 70% of all cats are going to have periodontal disease. There is no other disease that's that high. So when you're talking about preventive care, it should be something that all of our team members do on every exam. And again, it gets back to education. Like, how did we learn about distemper years ago, right? I mean, it happened, but we do education on vaccines. We need to add in education on dentistry equally or maybe even more important now.
I love that. And I wrote down a few things as you guys were speaking that I thought were excellent points. One is here's a new t-shirt idea, Darlene. Good to clean, better to rinse, best to
Right.
brush.
Good to chew, better to rinse, best to brush,
Okay,
for
I
sure.
can't read my own scribble. Good to chew, better to rinse, best to brush. Can
Best
we
to
get
brush.
that on scrub tops or
We
t-shirts?
should.
That's
We
that's a
should.
great soundbite and
Yeah.
easy to communicate to the pet owner. I love you throwing out the stats. Well, unfortunately, 80% of dogs, 70% of cats. That's an unfortunate but real situation we're in, and I think that should be in that puppy visit discussion. Of the things we're concerned about, of the
Mm-hmm.
things, and we look at the whole pet and kind of your priorities. This should be at or near the top or right near with those other, challenges
Yeah.
that you mentioned. How is it dentistry falls to the wayside in the exam room with some?
I know that we keep saying education to our clients, right? And we have to remember our doctors get very limited education in dentistry when they're in school. That's improving. It certainly is improving, and it's getting better because I think schools are recognizing the importance of dental education. So there is a shift of that. But majority of our veterinarians that are out there did not get educated about dentistry and how important it was and how to, do a lot of it and do the extractions and all of those things. So I think that that's part of it. And then I think the other part is time and remembering when they have all these other things to look at. But Doug, I'm sure you have plenty to add to that.
Yeah, I was gonna say, we've all been in the exam room. We all were sometimes rushed, and Mrs. Smith is in there with her new puppy, and so the client comes in with some. I'm here for my shots, right? I mean, that's what they're there for. And then, by the way, there's a flea running around. So what are they going to be focused on? They're going to be focused on flea control. They're going to be focused on getting those vaccines, probably getting a dewormer. Now, guess what? Your 20-minute appointment, you're now into it 19 minutes. You've got 1 minute to talk about dentistry. So I think it's just a matter of flipping the script, so to speak, because you don't know what you don't know. And same goes for the client as well as the team members. So back to education. And if you start the exam by flipping the lip and saying something about it, like, oh, I see all the teeth are coming in properly, it just gets them thinking about the teeth instead of about the flea running around. So I think that's what it is.
I think creating a process for your exam is really important, nose to tail, right? And even if you don't have time to discuss it, you write it down in the record, and that might prompt your technician to say, "Hey, Dr. So-and-so noticed some tartar in the mouth. We should schedule a follow-up about this once we've resolved the lameness," right? And then just that prompt is like we've already discussed it. We've started the education that might prompt that text message video about dental disease. So, you can start the education as quick as that and not have to take up so much time in the exam room educating. You can just have these little processes that trigger education for you.
Yeah.
And follow-up exams.
Yeah, just to piggyback off of what Darlene just mentioned with the exam is it doesn't really matter what the pet's coming in for. It could be a sick exam or a wellness exam. And especially for those sick exams, we're going to be looking at the gums anyway. So just flip the lip and then make some mention about the condition of the teeth and periodontal disease or the condition. It just sets the stage for making that important. And so the next time the client comes in, when that pet is well, it's kind of top of mind. And again, it's a process or something that's a full team approach and educating the client as we go.
Do you find that you quantify that or?
Yeah, Jimmy, that's a great point because we all are very familiar with staging of dental disease from 1 to 4, and that's a good thing and an easy thing to implement in your exams and verbalizing it too. Again, you flip the lip, you're looking at the gum, looking at maybe capillary refill time or other things, but you can just say, hey, to your technician or to the client, like, hey, it looks like we're in a stage 2 periodontal disease right now. And then there might go, what is that? And you may have some charts or handouts or something to cover later, but at least making note of it And then again, it's documented. So the next time they come in, you can start out by saying, oh, I see where we were in a stage 2 periodontal disease. Let me take a look and see what's going on today. So it does help.
Right. I think it's very important to make sure that we set good expectations for our clients. I think that it's great that what we see is potentially a stage 2, but to remind our clients that majority of the tooth is underneath the gum line. So without dental x-rays, we cannot verify that. And I think that's why it's so crucial to really make sure that your practice is doing full mouth x-rays and that you're setting the expectation to your client that you cannot see dental disease underneath that gum line. So you're doing the best you can on what you're doing on flip the lip, but the x-rays are going to tell you what's really going on.
To that point too, we need to make sure that we equip our team with all the tools that are needed. And as Darlene mentioned, full mouth x-rays and dental radiography is so important and crucial now, and really a standard of care that we need to provide. So making sure that your team is set up for success too. And we can do so much with just an exam, but in the back room, we need to be equipped to handle all of those things.
I love those points. And when you say the D word, disease, you catch people's attention, not for shock and awe effect, but rightfully so. Like you said, Dr. McInnis, we're picking up, maybe we're at a stage 2 periodontal disease or, state, and it's the pet owner is like, wait, what? What'd you say? It's good to captivate their attention on this topic. And then I also think I love this somewhat of a client bonding opportunity, for lack of a better description. But when you point something out to the pet owner that could potentially be a very big health risk down the road, and you let them know what's going on, you let them know we're going to want to perform a cleaning, we have things we can do to mitigate this. Also that pet owner is getting a little concerned about what's Dr. McInnis about to say next. What do I have to pay for this? But if you are having the conversation in the life of the pet, oftentimes, there are more times than not, probably, there are those opportunities to say, it's okay, Miss Jones or Mr. Smith, we don't need to do that today. But you plant that seed for, this is something we're going to keep an eye on over the next 6 months to a year, and something to prepare for. And I think they feel that a hair of a sigh of relief, financially, which I hate to but it's stuff costs a lot, and for people that want to take good care of their pets, they want to know what you're about to tell them, and they're mentally preparing to how to afford this. And so that also, if you're having the conversation all along the way, it's not that wellness appointment in year 6 of the pet's life, and this has never been discussed, and this is a big shock and potentially an expensive encounter that they weren't ready for. But if they had heard about it in years before, then they know this is coming, and that helps for budgeting purposes.
Yeah, and Jimmy, what you're mentioning too is really back to client relationships, and building a client relationship is so important, because then they're going to trust you. So you bring up some things that they're not there for, and then they get it, and they go home and they go, oh yeah, Fluffy's breath does smell a little bad. I guess maybe the doctor did have something here, and then they'll build trust, so that the next time they come in and you do present them with a treatment plan, that there's not the sticker shock as much, because again, they're trusting you. They know that this procedure needs to be done, and then they'll find a way to make it work. And that's where, again, back to the whole team approach, you can tie in your CSRs and your technicians to help them through the process.
Right. And I think what's important too is semantics is really important when you're sharing value and discussing things with clients. Like Dr. McInnis just used treatment plan, right? Versus estimate. There's a big difference in your client's perception and perceived value, as well as their attention span to what you're stating when you say treatment plan versus estimate. Also, they've done roundtable studies to see what resonates with clients. Porphyromonas, all of these things, they don't resonate with clients. Even disease is lower on the list. When you say infection or pain, those are the top 2 that resonate with clients when you're discussing these things, when you say there's an active infection in the mouth. And that truly is what's going on.
I would also say, kind of back to the exam room tips and tricks. If you think back to how I started the conversation here by mentioning, almost 30 years ago, we started a campaign that pets need dental care too. It's not we recommend pets have dental care. It's pets need dental care. So using that simple word in the exam room, need
Yeah.
versus recommend, like
Yep.
here is the treatment plan that your pet needs for its dental disease. That will resonate much better than, well, we would recommend getting a dental procedure done, and here's your estimate. Same thing,
Right.
just presented a little bit differently with a little bit different wording.
Yeah, recommend is definitely a word of the past. And for the technicians presenting the treatment plan, they're going to state, this is what the doctor wants to get done for Fluffy, right? So they're going to receive that as want or need versus that recommend.
The All Things Veterinary podcast is sponsored by Patterson Veterinary, supplier of products, equipment, software, services, and essentials for your practice. Patterson goes the extra mile to make sure you get what you need quickly, develops ways to help your practice run a little better, and backs it all with legendary customer service. Find All Things Veterinary at PattersonVet.com. One thing you guys have described is the team approach. So in terms of processes, can you guys, kind of describe that team approach philosophy that you have?
Happy to take it on. Yeah, I think that we need to remember that our CRVTs, our credentialed veterinary technicians, and our highly trained VAs are valuable to the team and getting time back to the doctors. And I think they need to be utilized in this process. And in dentistry, it's such a great value add. One, to be promoting what they do in that chair, right? So they're doing primarily the prophies, the cleanings, the x-rays, and really explaining that as part of your value. They're monitoring the anesthesia. And so as they gather all of that information, they could be learning also from the doctors about some of these exam room conversations. They could be really facilitating and being utilized to get back some of that time. That doctor doesn't have to spend so much time having some of these conversations once they've diagnosed the disease. So once that diagnosis is done, they could be following up with what we're going to be doing next. What does that mean? The follow-ups as well can be done by them as far as home care conversations. Home care is such a great avenue and line item for technicians to be utilized. And they want to be utilized in this sense. So I think having that team approach and really team-focused practice is so important for those clients to also build the bond with them too.
Do you have recommendations or best practices for getting your team? Maybe it's a new team member, maybe it's someone who's wanting to advance in the hospital. How do we get them to level up, or are there things, along those lines that you implement?
I can't say enough. Protocols. You need to have established protocols in your practice on how you do everything, the flow of dentistry, how you do the x-rays, so that everybody is trained with a unified message. If you don't have a unified message in your practice, then it's broken. If it's broken, then what is that client seeing in the exam room? Broken messages, which does not breed trust, right? So everybody needs to be saying the same thing when it comes to dentistry. They need to be sharing the same messages, and all of that comes from standardization of protocols and processes. And then the training leveling comes next. Once you have that, that breeds trust within the team too, right? So in order for a doctor to trust a technician to go forward with those conversations, they also need to know that the training is standardized and that they're part of building those processes. So stakeholder input, building those processes and procedures, then you can start the training for unified messages and then leveling to the next level, because the next protocol would be the next thing to go up. So I think that that's where you have to start, is foundational protocols, getting everybody on the same page, stakeholder input, and a unified message. Then you can go and shoot for the moon from there. You'd be surprised how you would flourish your team by just putting some value into them not just into the things that you're doing, right? Into your team as well, and sharing with them that you value them and that you trust them in some of these things.
Does the front office, is that an obvious question? Are you working the front office and
100%. They
how,
are part of the team.
and
They're
how,
the first person the client sees and the last person the client sees. So their messaging should be on point, right? So they should be stating that message, you're here for so and so. Maybe they hand a pamphlet out that shares that messaging, but that flow needs to start from reception to technician input to the doctor doing their exam. Then that technician comes back in, right, and sends them right back to reception. And all that messaging in that big circling flow is all the same.
love that. And that, it's not uncommon that an office will have a front office member who that might be their first position that they are hired for, but they have interest in getting in the back.
Let your CSRs watch a dental,
Yeah.
let
Yeah.
them watch a full cleaning.
Yeah. And cross training is so important, getting your CSRs to the treatment area so that they can see it and they can then understand and communicate to the clients what really happens. Because Jimmy, you use the term that I try to stay away from, the back. What goes on in the back, what is the back of the practice, right? So that's another one of those words that we should abandon and put a big X through. Anyway, I'll get off that soapbox.
It's a good one.
Getting them to see that, I think, is so important, because then they can take the value and they understand it, and it's going to resonate from that personal experience that they've had, instead of just having them in the front. They don't know. Otherwise, they are using that term. Well, in the back, this is what happens, right?
I should have warned you guys. This gives me a platform for an opportunity of feet in my mouth throughout. So
No,
I won't be the last. Heads up.
No, this is good. We're
just giving you a bad time. Just giving you.
Yeah, these are tips and tricks that we give to everybody, and it is important to make sure. I think semantics is very important when we're talking to our clients, because we do create our own stories in our heads. Humans are very good at that, and going down a rabbit hole. And if you don't put the story there, then they're going to create one. And it's going to look like a Sarah McLachlan video every time. So
Love it. All right, this is good. I want to kind of keep beating this drum, if you will. So one thing you've mentioned to me before, Darlene, is having the importance of having like a champion in the practice, a team champion, if you will. Who is that? What is that? How do you find it? Can you help us there?
yeah, I think that you need to find somebody who enjoys dentistry in the practice. I think that person is the person who enjoys dentistry. So if you have a CRVT that loves doing dentistry, or a VA that loves performing the prophies, and you have a doctor who enjoys doing all of the treatments and enjoys talking about dentistry, those should be your cheerleaders of dentistry.
Yeah, it's all about the passion. If they're passionate about it, that will again resonate to not only your staff, but also to the clients. And you'll feel it. It's kind of a culture of dentistry being built.
Isn't it funny how dentistry is one of those areas that not all are passionate and not all do enjoy, but the ones that do enjoy, there's a satisfaction to that. It's one of those, just specifically in a cleaning, there's that feeling of it's satisfactory to cut your grass and to see a before and after. It's fun to see a before and after, and to take those pictures and share that with the pet owner and help them see the visible difference and explain why that was a great thing we did for your pet today and their health.
Yeah, and Jimmy, I think that's a great point you just brought up about not everyone is going to be passionate about dentistry, but guess what? That's okay. Because at your practice, that diversity makes your practice stronger. So that doesn't mean you can't do dentistry. And I think that's a common thing that we miss all the time, is we're trying to put everybody into the square peg hole when they're round, or vice versa. But realize it's okay to be different, and it's okay to have different people on your staff that are passionate about different things. Well, guess what? That then becomes the champion. They're the true champions. And so when those clients come in, and if you're the doctor and you absolutely hate dentistry, all of a sudden you feel better because you know that Dr. Jones is our dental team member who is our champion in dentistry. You bring him in, you know, and it just again builds trust with the client, because the clients aren't expecting every veterinarian, every technician, every VA, every CSR to know everything about everything in the world. And I think that's something in veterinary medicine that we need to remember, is we don't have to be great at every single thing we do, but we need to know where those resources are so we can send people and our clients to those.
I just want to make a quick point too, is just based off of that, is remembering that you can cheerlead your doctor's individual strengths by using marketing. You don't always have to do it internally, right? So you can create smile books and really highlight cases that doctors are really good at. Maybe one's great at soft tissue surgery and they have before and after pictures of these big giant masses. One's great at dentistry, before and after pictures of dentistry, and the story about how that dog was maybe sluggish and was like a puppy again after they clean their teeth. These things can be put in the lobby when clients are waiting around. They can be put on the TV and flashed through a PowerPoint presentation. They can be put in books where they can read them, just like, a plastic surgeon would do, and on your website. So celebrate what they're great at, so that they all support each other.
I love everything you just mentioned, and that could even be an entire discussion of those. I don't even want to say tips and tricks, but best practices and like you said, highlighting. It's so, I think the pet owner really appreciates seeing that, in that a lot of the terms, a lot of the things we do to care for our animals, they don't fully understand, or what is, it's sometimes seeing is believing. And I love that. That kind of also, makes me think more compliance wise. I mean, is there the marketing component, the mentioning is in every exam room? Are there any other compliance builders, if you will, the full team discussion, but any other things that really help a clinic? I'm picturing the clinic, maybe, if you will, that, let's just say, a lot of their dentistry looks like full mouth extractions. Like they're almost extreme situations. So I kind of want to highlight, what happens, how do we get this in the conversation more? How do we get more into the preventative mindset? We've kind of touched on some of this, but any other points that you can mention to kind of get someone in the game, and maybe if they don't have that ingrained passion or interest, if you will.
I think the first thing a practice needs to do is establish a home care program, because the home care program allows the education to start shifting the mindset of preventative care, and building something into every single wellness exam, right? So every wellness exam, there's some sort of education around dentistry. But a good home care program does shift a lot. And I think, just from my personal perspective of being in lots of practices, not just WVP, but other practices that I know of as well, home care has been lost on the wayside. And that was a big driver of our preventative conversations.
I love that. I think that what a great starting point is to go there. Can you kind of describe that home care plan? That would be a good,
Yeah.
Maybe an intro point. Maybe not your full plan, but
Yeah, I mean, a typical home care plan, one, I'll give some tidbits. Never go over dentistry home care at time of discharge. It is imperative to get them back a week or two after a cleaning, regardless of extractions or not extractions. A client's time for compliance is not at pickup at discharge. They are emotionally constrained. Their dog's been away from them all day. They've had anesthesia. They're concerned about recovery. Last thing they're thinking about is brushing that dog's teeth. You are not going to be compliant. But there's a trick that I do feel really works, and it's sending them home with a recovery care. No different than the Jedi mind trick of treatment plan or versus estimate, right? It switches the mindset to think of something else. Recovery care is something a client can get on board with, because they want their patient or their pet to recover, right? So they're going to put that in the mouth every day. And it's also very good for that technician or that doctor who's doing the recheck at that 1 to 2 weeks, which I would really heavily rely on your techs doing this. But if the doctors want to do it, that's great. At this point, there's going to be a lot of feedback. How did that go? How did it work? Were you able to get it into the mouth? Were you able to do it every single day? Now you know whether this is going to be a compliant client or one that you're going to need to work with a little bit more, right? Then you can start choosing what you want to do with them. Brushing, always a brushing action. So whether it be a wipe or a toothbrush or a dental diet, needs to have some sort of brushing action. That's down, always. But we're busy people. So I think it's very important that we throw them a second thing. We say, when you can't do this, do this. And that's down on that algorithm again of that, good to chew, better to rinse, best to brush, and find out what's best fitting for that client. And then they need a follow-up. They need to be seen in the next 3 months, 2 months, whatever it may be, to see if it's working. You have to have a connection. And that's when you tell your client, we're in this together. If we do this right, we can hopefully slow down the progression of disease. We can also make it more financially feasible for you to take care of the teeth and be more proactive. So that's where I would lean on.
And Jimmy, also, you started out by mentioning, we're taking out all these teeth and this big procedure. Well, that's where it kind of starts, so to speak. But then back to forward booking. That's really what we're talking about here is let's forward book that. And you simply state it by, again, the team approach. The doctor needs to see you back in 2 weeks post dental, or we need to see you back in a month or 3 months or whatever that individual time frame is. And then that forward booking appointment, I would also recommend, back to efficiencies with your schedule and time, create a day or a morning or an afternoon, teeth on Tuesday or whatever it might be, to book them all together. And you'll also be surprised if you can book those technician appointments for those home care rechecks all together. Well, guess what? All of those clients are out in the waiting there for you or back at the CSR. It builds efficiencies and processes because you're thinking dentistry. The team is just thinking dentistry all at the same time, as well as the clients chit-chatting back and forth. And it just builds excitement amongst everybody and the importance about dentistry.
I need a bell for the podcast because when you said recovery care plan, I wanted to ring it like a ding. And then when you repeated the good to chew, better to rinse, better to brush, I want to hit another ding. And then Dr. McInnis, forward booking, I wanted to triple ding. Man, I love forward booking. And what better way, if a practice isn't doing that, what better way to start or maybe consider more heavily emphasizing than dentistry? Our human dental friends are the experts in forward booking. And I swear, last time I was in for a cleaning, I swear I was still like strapped into the chair. I think they had my mouth pinned open and they wouldn't like let me out until I like etched my name on a calendar of my next appointment. They're brilliant
Well,
at getting that.
yeah, and I think back to kind of some mindsets, or think about it. If you're the client bringing in your dog, don't think it about on your end, but we're almost like, if they don't forward book our appointment when we leave the dental office, we're like, what is wrong with this office? Well, guess what? We're providing dental care to our pets. We should be thinking the same way.
Right.
So forward book that appointment, because if you don't, they might think differently of you, like, well, maybe this isn't important to them.
I agree. I mean, as a mother, like my daughter sees her dentist on point because of those forward bookings. I don't even care what day, just okay, 6 months, they put it in, and I'll get that text message. Oh my gosh, we got to get to the dentist. We have a dental appointment. It's so much easier. It also relieves that stress that we put clients under of trying to pick the day and the time. And if I need to reschedule, it's right there as a click on my text message to reschedule and switch the day. We have to start getting in that mindset of technology and utilizing it for ease of everybody.
Agreed. Those are such powerful tools that we have at our disposal today. And like you mentioned to start out the podcast, where we are, in this discussion versus 10, 15, 20 years ago, these are tools that are easy to implement. They're convenient for the pet owner. When they do book it, standing in front of your front office or in the exam room, wherever that takes place, there's that sense of duty of, oh, I got to do this. And we can piggyback off of our human healthcare friends in many ways. I think this is one of them, which is this is just what we do. There's not a lot of
Mhm.
options here. This is what we do to take care of your pet. And boom, we'll see you in 4 weeks, 3 weeks, 6 months, whatever
Yep.
that is. Great points, guys. I do want to transition really quick to another segment of this discussion, which is one of my personal favorites, which happens to be equipping the practice to perform these procedures properly. Do you guys mind, kind of touching on those points on what you are utilizing in your practices and things that you found really help raise compliance in dentistry, equipment wise?
Well, I'll start out by, we already mentioned dental radiography. That's paramount, probably one of the bigger investments, but so important. What lies beneath the gingiva, I think, is one of the topics of our WVP Dental U. It's like, hey, it's important of what's underneath of that gum line. Again, can't stress enough making sure that you have dental radiography. And then also your dental instruments, that make sure that they're not broken. They're not that expensive to get. They should be sharp as well. I think Darlene teaches, how to sharpen your instruments and, keep them maintained and equipment maintained. And then I'm going to throw in a little plug here too for anesthesia, because we do need to have our anesthetic equipment maintained up to speed, in great shape, and for these procedures, because, a bad anesthesia equals a bad outcome, and it doesn't matter how good your dental procedure went.
Yeah, I agree with Doug. I think it's imperative to have good functioning working equipment, understanding what each tool does too, so that you don't misuse it, break it, bend it, and then now it's not appropriately used. Making sure they're sharp, because injury is definitely number one issue when doing extractions or doing hand scaling or curetting with dull instruments. You can slip and injure the animal or injure yourself. So making sure that you're using your instruments appropriately and that you have the appropriate tips to be efficient. A lot of the inefficiencies is not your staff. A lot of the inefficiencies is inappropriate use of tools or using dull instruments. So you really do need to take care of them and make sure that you have appropriate tools. And then to follow up with that, you need training. You can have all the tools in the
Mhm.
world, but you'll never be efficient without training and how to use them. So it's great to have dental x-ray, but if you have staff taking 30 minutes to take x-rays, then you're going to be into 4-hour dentals. So they should be 10 to 15 minutes, 20 minutes tops to take full mouth x-rays. The key is not to say, oh, we'll just take one tooth and just shoot what I need. That's not the answer ever, because 9 times out of 10, you end up taking more shots when you take individual shots, cheaper for a client, than just doing full mouth x-rays properly. So please get the training and do it properly.
Great points. Follow up on that training part. Is that something you guys like to do in-house, taking, maybe some staff meeting time to discuss, send your people somewhere, combination of all of the above, I would imagine.
Yeah, Western Veterinary Partners is, we're 5 years old, and we've grown to close to 300 practices in a short 5 year time span. But one of the things we identified right out of the gate is wanting to provide education and training to our veterinarians and team members, technicians, VAs, etc., CSRs. And so we selected dentistry as kind of our starting point for several reasons. One of them is, as we mentioned previously, it's getting more attention in veterinary schools and veterinary technician programs, but it's got a little ways to go. And it's something that is being asked for that reason. And then also for the reason really of efficiency. That probably is a bigger one. We can provide the training and tools that our practices can improve the quality and patient care and reduce down that anesthetic time, and then open up your schedule for end result being providing more dentistry to more pets.
And take the time to be okay with shutting down for a few hours for a training, or bringing somebody in-house to do the training on a weekend when you're closed. be okay with that, because that investment will go a long way, a very long way.
Agreed. And to kind of add a thing on the equipment piece and the sharpness, kind of point and knowing how to use the tools properly, I have found myself preaching over the last couple of years on having backups of a lot of these tools. A lot of these tools, whether it be a scaler, just a drill, high-speed drill, all some even as hand instruments as backups, having backups set aside, cleaned, ready to roll, I feel like is a really good best practice that I don't feel like I see all clinics doing. It's going to happen. Something's going to break during a procedure. It's the worst time, can cause just a host of problems. And I think having good backups ready to roll is, a lot of these tools aren't super expensive individually, if you will, to kind of piece together a backup pack, if you will, that costs a lot less than having to reschedule a full day of dentistry or wake a patient up, interrupt something, et cetera. But to your point too, Darlene, I feel like using equipment properly, especially these high speed hand pieces, I'll just pick a couple, and that comes with replacing your burrs, sharpening and or replacing your dental scaler, the end of that maybe every 6 months, plus or minus. These little replacement frequently as they're written and instructed on the equipment costs a lot less. And how many times people break instruments because they're using dull, instruments and tips and stuff.
Right. Absolutely. I think we have to remind people, like, an ultrasonic scaler is great and sonic scalers are amazing. But if you don't use them properly, they're just going to cause damage, or they're going to slow you down. And then you're going to say, oh, this instrument, is horrible and I hate it. It's like the pulse ox. Everybody hates the pulse ox, but they
They
just
do.
don't understand how it works. And if they took the time to really understand the light technology, they wouldn't shine bright lights over, over it.
Right.
And then it's just misunderstood, right? I have a soft spot for SPO too. So,
Yeah.
but for those tips, you got to remember 1 millimeter of loss of metal on that tip is 25% efficiency loss. 2 millimeters of loss is 50% efficiency loss. So you should check your tips before use or after use every single time so that you are managing at the peak efficiency. Also, to your point, the backup pack is so important. If that sonic scaler breaks, what are you going to do if you don't know how to hand scale? If you have hand scalers, you can easily still do your dentistry and perform a good prophy still if you know how to do it. Same with extractions. If your drill breaks because you burned out the turbine, right? Well, then you should know how to luxate. Closed extractions are actually well talked about. I was just at the dental forum and they were really talking a lot about closed extractions and no need to be doing so much drilling like we're drilling. Having a luxator kit and having a backup in those sense, so you don't have to wake up that patient, re-knock them down. You should know how to do these things. So
Yeah.
it's good to invest in that education and learn different modalities so that you can be prepared for these things.
Yeah. Yeah, and I think too, and after you've received the training and you've developed a dental champion in your practice, rely on them as well. Give a little shout out to Patterson here, but you guys have some excellent resources and people that can come into the practice and let them take a look at your machine, your equipment, and make some recommendations. Sit down with the dental champion there at the practice and go, hey, here, this is what we would recommend. And a lot of these things are not expensive. And likewise, I'm from the veterinarian standpoint, suture material. My favorite is not a name brand suture, but there's some great ones out there that having the right suture on hand, because commonly a lot of practices will just have it for their spays or their neuters or other surgery procedures, and then you just have what you have left. But if you don't have the right supplies, that can also be impactful. So not just the equipment, but remember about the supply side.
Great points, and thank you for the plug, Dr. McInnis. Patterson would love to send out a trained equipment technician to do a once over or scheduled monthly or quarterly maintenance of not only your dental equipment, but like you said, the anesthesia machines go hand in hand. they can take a look at that, take that off of the champion or staff's plate. A lot of times, because it's busy, it's worth paying somebody a little bit of money to just handle that component so that you can then focus on communication, marketing, discussions. But those go hand in hand. So thank you for bringing that up. I think that's worth, especially as we winter months. I hate to pigeonhole any times of year for certain things, but good times maybe to be prepping for the next year before the doors blow off in spring and summer and fall in a lot of areas around the country. But kind of getting toward the end of our discussion, you mentioned WVP, Western Vet Partners, a little bit earlier, Dr. McInnis, and some of the priorities. Do you guys mind just kind of telling us a little bit more about WVP and?
Yeah. As I mentioned, we're 5 years old, and we partner with practices. And as mentioned, we're now approaching 300 practices. And
Wow.
As we build that out, we are not changing what medicine that you take. So it's really just a partnership, a true partnership with the individual practices to allow them to keep the medicine their own. But we provide education and training and resources to help support them. So we want them to grow. And that's especially why we developed the medical advisory board, and also key to have a technician on that team as well. And so that's how we also think about dentistry. And our WVP Dental U is really structured identical to how we have our culture as a company. And it's a team approach and bringing everybody together and leveling up, as was mentioned, so we can improve efficiencies and provide those resources so that you can go back to the practice. And then what we hope is you take what you learn from our Dental U course, and then spread that amongst your staff. And Darlene is doing a great job of reaching back out after the attendees go to the class to make sure that happens. So
that's neat. It's really neat that you guys are investing in a Dental U program for your partner hospitals. That's a big investment of time and resources. And I think, like you mentioned, it's attractive for potential clinics out there and folks that want to tap into those resources and focus and opportunity to learn more to specialize more in that important arena. And it sounds like that's something you guys plan to continue to do and maybe even expand into other areas of the hospital, which is really neat. Darlene, you've partnered with WVP, I think you mentioned, about almost close to 5 years ago. Is that right?
Yeah, so I'm a selling owner, and I partnered
Okay.
with WVP in 2021, and was one of the best decisions I made. I mean, they're a wonderful company and super supportive, as Doug was saying. They invest a lot into the support of their technicians and their staff and their doctors. I think that was super important for me as an owner that was selling to an organization.
That's great. Well, and kudos to WVP for integrating you guys, before, during, and after the partnership and adding leadership going forward. It's always neat to see that your legacy continues on and shaping the future of the organization, being a part of it too is neat. You're help leading that charge. So yes.
It's unique and very, very neat that we can be part of it, and still continue on and from a different perspective help other practices, which is really nice.
That's neat.
Yep. And as others have said in our organization, it's fun to build the plane and be flying and riding in it and continuing to build it as we're flying.
Sounds exciting for sure.
Yes.
Guys, you guys gave so much wisdom and knowledge and great tips. And I know we want to thank you for coming on and giving your time and giving those tips. It's very much appreciated. You guys have been fantastic today. So thank you so much.
Thank you so much for having us.
Yes. Thank you, Jimmy.
Thank you for listening. Join us for more ideas and inspiration on the next All Things Veterinary podcast.